A new fear unlocks when I tell you that your vagina could actually go inside out and fall outside of your body. But is this a real thing? Hi, I'm your local OBGYN. I love women and let's talk about it. So, the reality is that the vagina is just kind of like a tubular structure. It has some flimsy ligaments that kind of like tack it up and keep it in place so that it's kind of like a tube with an end point to it so that it should stay where it is, but it's really only as supportive as the things around it, which include your bladder and your rectum and really very much so your uterus. If you have any connective tissue issues, chronic issues like coughing, if you had lots of babies, things like that, that tubular structure can go and start to do unusual things. And some of those organs that are around your vagina, again, your bladder, your rectum, and your uterus, can start to push down if sort of the supporting things that keep them in place start to sag or are overly stretched. And then the vagina can kind of flip inside out. And when it flips inside out, it's sort of up to us and or a urogynecologist to determine what is actually pushing out. And we kind of have to do this specialty test called a pop Q and kind of figure out, is it from the front, the back, the middle, what part of the organs are pushing out. But when it does push out, it looks like an inside out sock that can be filled with whatever those organs are that are pushing down. And it kind of can look like a pink pear or grapefruit hanging between the legs. It doesn't even have to be that far, it can just be a little bit, but this is what's known as a prolapse. It's not uncommon. It is something that you should not be embarrassed about, but there's ways to manage this so that you can have a better quality of life and you don't suffer with parts falling inside out.